Hello, everybody. Thanks so much for joining us today for our UW Medicine Office of Healthcare Equity Community Conversations. We are here today with a really important topic discussing MyChart, changes that are coming to MyChart, and additional things about that. We will be putting a link in the chat where the recording will be put up. You can visit our Community Conversations website in the next couple of days. Our Q&A function is open as well, so please feel free to submit questions if you would like to. I'm going to turn this over to Dr. Chopra.
Thank you so much, Priscilla. Welcome everyone to this really important community conversation based on the changes coming to MyChart messaging. And we at UW are committed to providing our patients up-to-date information, not only on the changes, how can they use MyChart messaging better and be able to be better in touch with their providers. So I'm so honored to have an amazing panel with us here today. I welcome all of you, and we will start off by Dr. Seine Chiang. Dr. Chiang is a gynecologist specialist and surgeon. She's the chief of OBGYN Specialist Division at UW Medical Center and is a professor in the Department of OBGYN. Dr. Leo Morales is Assistant Dean, UW School of Medicine. UW Medicine, he's Director of the Latino Center for Health and is Professor at UW Medicine Department of General Internal Medicine. Welcome, Dr. Morales. We have Dr. Sara Jackson. Dr. Jackson practices adult medicine, and she is Director of the Adult Medicine Clinic at Harborview Medical Center and is also Associate Professor at UW Department of General Internal Medicine. Thank you for coming, Dr. Jackson. We also have Dr. Crystal Wong. Dr. Wong is a family medicine doctor at UW Primary Care Ravenna. She is Associate Chief Digital Health Officer at UW Medicine Digital Health Office and is Clinical Associate Professor at UW Department of Family Medicine. Thank you so very much, Dr. Wong. We also have Priscilla Estrada, who is a communications specialist at UW Medicine Department of Healthcare Equity. Thank you, everyone, for joining us. Over to you, Dr. Wong, for a background on MyChart messaging and a background on why we are doing this today.
Yeah, hi, everyone. Before we dive into some questions, I thought I'd set the stage a little bit and actually orient everyone to specifically what we're going to talk about today. I know there are a lot of features in MyChart, and today's session is not going to be about every single thing you can do in MyChart, but specifically around MyChart messaging. So I think all of you have logged into MyChart before. If not, this is the homepage. This is what you would see on the online version. You put in your username and your password. And then one of the first things you'll see is this drop-down menu. Now it has a lot of things you can do in MyChart, including looking at your medical records, looking at previous MyChart messages, looking at your medications, looking at your problem list, all sorts of things. But what we're going to focus on is in this communications menu right here. If you click either messages or ask a question, it actually leads you to this little drop-down menu where you can get some specific things done. But we're going to be talking about this little box here that says ask your clinic a question with this little Band-Aid icon. And for those of you who read through the email, you'll know that this is really the section that you're going to see the new disclaimer that consents people for potentially getting a bill for specific types of messages. And one of the things we're going to cover today is, what messages are billable and what are going to continue to be free. It's really just a small slice of the pie that are potentially billable. Now, all of this is really in conjunction with, changing demands of consumers and patients. This graph here shows the number of MyChart messages we've received from patients kind of year over year. And you can see we started out in 2019 with just over 500,000 messages in that year. And in 2022, with the escalation of use, I think, this is just such a convenient method of contacting your care team. We received almost 1.5 million messages at UW Medicine. And, I think this is really showing, desire of patients to get timely answers to their questions, our preference for digital means of communication, and honestly, sometimes access problems, in our more traditional service delivery. So we really look forward to kind of diving into this with you guys, answering some questions, and then just making sure that everyone understands the rationale behind starting this program.
Thank you so very much, Dr. Wong, for giving us this overview. And I think we should dive into our questions that the community has sent us. And I'll start with you, Dr. Chiang. What things should patients message their doctors about? If you can, throw some light on that for our patients.
Great. I would say from the perspective of having a surgical practice, as well as just a complex gynecology practice, things that patients should message us about might include clarification as to test results that they need follow-up on. So in my world of gynecology, I may have ordered a pelvic ultrasound. They may have questions about, oh, now remind me again about the timing of the ultrasound. Maybe that wasn't clear. So clarifications are really quick and easy and very important question to clarify before you get the test. Follow-up questions are important. And it's a reminder to the community that the standard is that we try to answer the questions within 72 hours. And keeping that in mind, at least in a surgical practice, post-op complications, if there's just a question about I'm spotting after surgery, it doesn't sound urgent, the patient feels like they can wait a couple of days to get the results and hear about it, that would be perfectly appropriate. But a message such as I'm really bleeding and soaking through, my underwear, keeping in mind that we may not be answering these within 72 hours, that would be more urgent and probably not so appropriate. And then maybe Sarah will have, Dr. Jackson has some insight from a medical practice perspective.
Yeah, and I work at Harborview and see patients with kind of complex medical and social conditions. And I would say, if anything, I do encourage patients to use MyChart. I think it can be a very efficient way to get connected to the clinical team, particularly, unfortunately, compared to our phone tree at times. And honestly, I don't mind, questions about, if there are side effects from a medicine that was started, or questions about new symptoms, questions about, you need a referral because of X, Y, and Z. I need some equipment at home. All of that stuff, I think, is reasonable to send to the clinical team.
Thank you, Dr. Chiang and Dr. Jackson. And practicing in outpatient in an outpatient clinic, what I feel is that a lot of our patients underutilize MyChart messaging, and especially the older folks and older patients. I think that once they get familiar, this can be a very useful tool to be in touch with their doctors. During the pandemic, we found that it was extremely useful for older patients, especially who had COVID infection, to understand whether they qualify for medication or not. And I think that that is a very good way of communicating. And also I want to emphasize that sometimes it takes much longer when using the phone tree, and it is easier to reach your doctor through MyChart messaging. So I really encourage patients to utilize that. Thank you so very much. Dr. Wong, the next question is for you. What options do patients have to get their questions answered?
Yeah, thanks, Anita. I know this isn't going to be an exhaustive tour of MyChart, but there are actually some functions in MyChart that can kind of get patients straight, cut to the chase, basically. I know, you're a primary care physician like me, and we often will get simple emails just saying, I want to schedule an appointment, or I want to look at my labs, or all of these things. And I don't think sometimes patients realize that you can just get straight into that. So there are separate buttons for requesting refills. You can actually look at your medicine and just choose the one you need refilled. You can also just go straight ahead and schedule with your provider. There's actually a way for you to kind of take a look at available options. You don't necessarily need to message us to schedule you an appointment. You can self-serve there. Additionally, all the labs, radiology, your chart notes, patient instructions from visit, all of that is open for service. So, and all of those are not billable. You know, even if you send me a message asking to schedule an appointment, that's not billable, but you can also just pick a section and do that yourself. Now, I know that MyChart messaging, you know, asking, you know, free text question, that's kind of nice because it's a catch-all and we want to encourage patients to do that. But, you know, typically simple messages, you'll get an answer to through that, that pathway easier. You know, if you type something complex, you know, typically we'll ask you to schedule an appointment, which I know, you know, we run into our access problems there, right? You know, you ask a question, we take 3 days to get back to you, and then we just tell you to get an appointment. And I think that's dissatisfying for patients sometimes. So, you know, I think that's some of the rationale for us being able to offer these kind of MyChart message visits that we'll get into, you know, a little bit later in the agenda today.
Thank you so much. For my next question, I'm actually going to ask all of you, you know, one by one, and to get perspective from all of you. But let's start with Dr. Chiang. Can you please give me some examples of care that could be handled over MyChart message instead of a patient coming in for a visit?
Just like Dr. Wong mentioned, something that requires maybe just a couple of lines, a clarification on timing of tests. And I think I actually inadvertently kind of answered this question on my first part, would be probably very appropriate. Clarification about test results, that we might have released the results and they're like, is that normal? I try to tell them it's normal because there's so much wording as part of test results that they're reading through it, not knowing, well, what does this mean? Those are really easy and appropriate. Mild symptoms, they just want to know about side effects, like Dr. Jackson mentioned. That's usually a quick answer back to reassure them. So those are some examples of appropriate questions or things that we could easily handle.
Dr. Wong, would you like to weigh in on it as a family medicine physician?
Yeah, I probably get a few of these a day that could potentially be answered via MyChart instead of, you know, what I currently do, which is, you know, tell them that they need to come in for an appointment. You know, I think kind of the bottom line for me in differentiating which ones would be kind of a billable message and a non-billable message, or what I think today between what I can actually answer in MyChart versus tell a patient to come in, is whether there needs to be some dialogue back and forth with the patient. You know, oftentimes a patient will send me, you know, a new concern or some new symptoms. And, you know, in order to give them good advice, I need to ask them a few more questions. You know, that's what we call evaluation and management in medical terms. You know, to talk specifically, you know, I think the shift to more and more services being available to patients digitally has really enabled access for some key populations. In my practice, I take care of a lot of patients with disabilities, adults with developmental disabilities like autism or CP or things like that. And actually, I take care of a lot of patients that don't live in the Seattle area either. You know, with the pandemic, a lot of people kind of moved. I had a lot of patients move to Eastern Washington, I think because of cost. And I actually have a slice of patients that have disabilities and live rurally. And these services have been really, really beneficial, you know, whether it's telemedicine visits or now being able to give them this opportunity to get some care kind of what we call asynchronously, meaning they can send me a message, I can send them back a message, I can take care of them, you know, not in necessarily real time. You know, I think specifically I have a patient who has spinal bifida and he lives in Tri-Cities and he's very complicated and it's very difficult to facilitate care locally for him because he's so complex. And a lot of times that means he has to drive all the way out here, you know, to see his specialist and whatnot. And even if we do set up a telemedicine visit with me to try to, you know, address some of his concerns, like for instance, he has a lot of recurrent UTIs. there's a delay to get in to see me. He might wait 3 or 4 weeks. And this way, enabling this type of asynchronous visit, he could email me his symptoms. I can do some back and forth. I can make sure the urinalysis, goes to the local lab, et cetera, and, get my time accounted for too, rather than just having to tell him he needs to at least schedule a telemedicine visit, which might be a delay in his care. So, as I was thinking about examples, I think that would be an example of a patient who would actually benefit quite a lot from us being able to do this.
Dr. Morales, what has been your experience?
Thanks, Anita. So, so I practice in a diabetes clinic. So most of my patients, all my patients are diabetics. And I want to just echo one thing you said earlier, which is I encourage all of my patients, and many of them are, well, I'll say most of them are Spanish speaking, to get onto MyChart and start using it, because there are so many advantages to having this ability to communicate with your team without having to come into the clinic or go through the phone tree. So I'm highly, I highly encourage patients to get on. The kinds of questions that I've dealt with on MyChart questions are things like insulin adjustments, and patients that we've set up a plan, and there may be questions that come up about, well, maybe I should use a little bit more insulin, a little bit less insulin. So that's something I've addressed over MyChart. Use of supplements. So sometimes patients will say, well, is it safe for me to use this supplement, or can I, would it be helpful for me to use this supplement? So I've responded to those. Questions around side effects. So we may start a new medication, and people maybe have a patient will have a symptom and they want to know, well, is this related to the medicine I'm taking, or is this not? So I've answered those sorts of questions, lab result questions, and also questions around like, I need help financially. How can I do that? Or I'm having trouble affording my medication. So I try to direct people sometimes, to the right source, even if I don't have the correct answer. Like Dr. Wong, I have patients that, once we establish care, they may live far away. And MyChart messaging, just like telehealth visits, are hugely helpful. So I have patients in Yakima and Grays Harbor, up in Shoreline, and all of them were communicating through either channel, through telehealth as well as MyChart messaging. So very helpful.
Dr. Jackson, can you share your perspective with us?
Sure. Yeah, we're probably going to echo things that people have said, but I do think one of the advantages in primary care is that we do know our patients well. And though they may have complex things going on, I do feel like that ability, just like everyone was talking about, the transportation issues with coming in for a visit that's scheduled weeks out when the acute issue has already gotten worse. I strongly recommend, and our challenge is getting people on MyChart. It's a really efficient way to have somebody who knows you well be able to tell you, what their thoughts are. And sometimes that is complex and can go back and forth, but I still feel like that's good care and patient-centered care. So
I think that's so useful to get, perspective from surgery and from family medicine and from adult medicine, as well as from the diabetes clinic. I just want to share my own experience with one of my patients who's been a long-term patient of mine, who we walked through getting on MyChart, who was very hesitant at first because she was not used to it. She did not want to start something new, and she preferred being, on the phone or, getting live help. And we gently walked her through getting her on MyChart messaging. And this morning, I got a message from her that she had bumped her head and was having symptoms of a concussion. And she wanted me to tell her what is the next step. So thankfully, I was able to guide her on time. And she remarked how thankful she was to be on MyChart and be able to reach us in time. So I think I just wanted to share this patient experience just to underline the fact how important it is to have that tool in hand to be able to reach your physician through MyChart. We'll now go on to the new change that's coming to MyChart messaging, which is billing, which is billable MyChart messaging. And I will actually start off with Dr. Morales. Dr. Morales, what are some of the things that the patients can do via MyChart that are actually not going to be billed?
Yeah, thanks, Anita. Before I answer that question, I also want to just mention another way that I've seen patients use MyChart messaging is actually their relatives. So thinking of the person within a family, even if the patient themselves is not comfortable, there can be a child, or a relative, a caregiver who is communicating with the team on behalf of the patient. And so there are ways to sort of use this tool, even if you're not directly using it yourself. So yes, so some of the functionality of MyChart that won't be billed include things like making appointment requests, refill requests, so medication refill requests. Importantly, questions that have been occurred in the last 7 days. So questions that are follow-ons to questions in the last 7 days will not be billed. Questions about billing will not be billed. Questions that lead to an appointment. So if someone does present a complex question, the provider feels that this is going to require a visit, that message will not be billed. And messages initiated by your healthcare team. So if you receive a message from your provider or the care team, you should not hesitate to respond because that will not be billed. The rule of thumb is if a question takes more than 5 minutes of your provider's time to answer, one that you have initiated, that question may be billed. And I think there'll be more about that in the next set of responses.
Thank you so much for this clarification. Next, I'll go to Dr. Wong. Dr. Wong, how much does a billed MyChart message cost? And there are questions about this in the Q&A as well. And also, if you can please comment on when patients use messaging, will they be told at the time it is billable?
Yeah. First, let me just reflect on a little bit of data that's been out there because we're not the first system to enable this tool. There's actually been some publications out of some other academic medical centers that went live, notably UCSF. They're actually one of the first AAMCs that pioneered kind of this workflow. And most systems where this is turned on, they're only seeing about 2 to 3% of all MyChart message being billed. And that's because it's really a select group of services that the billing can be applied to. And I think a general rule of thumb to think about as a patient is if this message would take the place of an appointment, then it's billable. This isn't, getting nickels and dime for small messages or requesting an appointment or needing a renewal of your massage therapy referral. I mean, I get those like every January, I get like 20 renewals of massage therapy referrals. Those things are not billable. We're really looking to enable a new service for patients, which is to get asynchronous care. And that's what these codes are for. So what does it cost? So I think first, again, just to set the context, this should be compared to a visit in terms of cost. So for some patients, this might actually be a lower cost option because, coming in even for a telemedicine visit with me is actually quite expensive. Could run several hundreds of dollars. The cash price without any insurance coverage is $27 to $98. And the reason why it's tiered is because it's a time-based code. There's 3 different levels of time that can be billed up by your provider. Now, all major insurances cover this, including Medicare, Medicaid, and commercial insurance. Obviously, your individual plans, co-pays, deductibles, all of that's going to apply. We do have financial assistance there for people who are struggling to pay their bills, whether or not they have insurance. We also have the ability to get, personal estimates from the finance team. But again, I think if you're looking at this through the lens of this is in lieu of a visit, it actually is a more cost-effective measure for a patient. So, what is this going to look like, in practice? So when you attempt to send a message, you will get a pop-up disclaimer that you have to click through in order to get to send a message. Now, if you decide you don't want to send that message, there is a link that will take you back to the scheduling page. And so you will consent to potentially getting billed for this. It's interesting, UW actually ran a pilot about 2 years ago when these codes first kind of arrived to the market, where we piloted clinics actually, when they received a message that could be billable, they would send a consent to the patient asking, hey, this could be billable. Would you rather have us bill this and answer it here, or would you rather come in for an appointment? And actually, uniformly, patients did not like that. They did not like getting a message from their team asking if they could bill for this message. And then, this was also demonstrated by many other universities who tried this, like UCSF, and that's how they ended up with their workflow where they put the disclaimer on the general MyChart message page. So, to send a message, that will happen. If it's billed out, you will get an automatic message saying that it was billed. However, I think that you should be able to kind of know whether or not this is billed by the content that you received from your provider. So number one, it has to be from the provider, like nurses, staff members. If they answer your questions, that's totally not billable. Secondly, if there's a lot of back and forth, I think I mentioned this before when I was talking about my example. Usually one of my lines for telling patients they need to come in for an appointment rather than me being able to answer one of these is if I need more information. So if you got an email back from your provider saying, oh, I'm so sorry, you think you have, a UTI, can I just ask a few things? Do you have a fever? Do you have back pain? Have you had a UTI before? Have you had any triggers like travel, et cetera? And then, you get into this correspondence. Oh, I looked at your last UA. It looks like you grew something that was not susceptible to this. I think we better choose this antibiotic instead. What do you think? That's dialogue with the provider that's really using their expertise and managing your specific condition. So that's basically what you would get from me if you're in my office and we're there talking about your UTI. So you should kind of know based on the back and forth you're having with the provider. If it's just a, yeah, no problem, I sent in your referral, that's not going to be billable. It doesn't take me 5 minutes to renew a massage therapy referral. So, I know that this is new and it takes time for all of us to kind of get used to this, but the way that I'm really looking at it and how I'm going to deploy that for my patients is really, can I save a patient a visit by answering this in MyChart?
Thank you so much for this clarification. Dr. Wong, when patients, they do send in a message, with their question, are they informed that it can take up to 3 business days to get a response back?
Yeah, so this is something that actually is, what do I want to say, perplexing for those of us who receive MyChart messages, because these things, okay, so maybe this is too much sausage making for you guys on the call, but they don't come straight to your doctor. They go to a team that works, because there's quite a bit of things that our team can answer. Like my RN can help with your meds, they can help you with that scheduling appointment, et cetera. We don't want all of those 1.5 million messages landing straight on my box. I'm seeing patients at the time. I do these on my lunch break. I do these in between patients, So there is a delay between it showing up. Now, when you click into it's what's called tile, that button that you push, it does give a description for patients of what is appropriate. I think it says something about this is not for something urgent or acute. If it's an emergency, please call 911 and, expect that this isn't going to be answered for 3 business days. So, we're trying to set the stage for patients for expectations for that. Have I had ones of patients actively having heart attacks sending it through that? Yes, it's not awesome. We always are kind of freaking out when that kind of happens. But that's not what it's designed for, nor is that, the safe thing for patients to use MyChart messages that way.
Thank you so very much. The next question is for Dr. Chiang. Why is UW Medicine planning this billing for MyChart messaging? Why are we doing this?
So I think Dr. Wong covered a lot of this, and that is that it's just another option for patients to get timely care. We all know that I think most offices are backed up. Sometimes the next appointment can be several months later, and it may not be convenient for the patient. And this is receiving and billing for personalized care by your provider, by your healthcare team. But the billable part is when the provider has to weigh in and there's some level of chart review. We have to ask further questions. We've got some back and forth. It really is just what we would do if we saw the patient or had a telemed appointment. So it requires some level of professional expertise and time from the faculty member or the provider, and therefore felt to be a billable service. And I think, as Dr. Wong mentioned, it's less costly overall. I mean, I practice at Roosevelt Clinic where there's also a facility fee. So even coming in, it takes away that layer of it. So definitely more timely, asynchronous. You're getting expert advice from your provider and overall less costly. So that is why UW Medicine, I believe, is planning to bill for these visits. And I also wanted to weigh in on that comment about the 72 hours in the emergency, because I saw a question about the chat. And I think while post-op complications are also one that kind of falls into that category, while we do want to hear from patients, we do worry about the patient safety aspect of it, that we're not getting to it, that they're messaging us with something really actually quite urgent and really should be going to urgent care or the ER. Not that we don't want to hear from them, but maybe they message us on their way and then head to an urgent care center or emergency room, because some of these issues are urgent.
Dr. Chiang, thank you for clarifying this, but is this also an effort to increase access in terms of patients getting in-person appointments as well? Do you see this helping out in that regard as well?
Oh, absolutely. I mean, I think of this as one, we only have so many appointments, and MyChart messaging that are billable visits are, I think, from a provider perspective, an extension of our office hours, right? For our patients who work, for our patients who need family members who also want to help craft the message. I think it definitely, I've seen that extends, it improves access for all of our patients versus a telemed appointment, which is still calendar in clinic time or in-person appointments. This is an extension of our office hours, is the way I look at it.
Dr. Morales, if you can weigh in on this in terms of our older patients, they are worried that they may not be able to. Is this a way that that actually inhibits or acts as a barrier between them and their provider, or is it the other way around? What would you say to some of our older patients?
Sorry, Anita, that was kind of hard for me to understand.
Sorry,
Yeah,
I think
better.
I was covering the mic.
Oh, okay.
What I was saying is, what would you say for the benefit of our older patients? Because they see this as an additional barrier between them and the providers. What would you say to the fear that they have that they would not be able to access their provider that easily?
Yeah, so I think it's a matter of learning this new way of interacting with your doctor, your provider, with the healthcare system. It's a new form of care. And I agree that it's going to, I think it has, I've seen it in many cases, improve access. So what would I say? I would say try it out with a family member if you're unsure. I think the billing issue, obviously, we all are concerned about costs, our out-of-pocket costs. However, we also, worry less if we see the value in what we get back for the money we spend. So I would say experiment, try it, see if you're getting the value you want from the interaction based on the cost. I think most people will find that it's worthwhile. And, you know, if you factor in costs like travel time, parking, you know, if you need to coordinate in terms of caregiving or leaving a job for a period of time, you know, all of those inconveniences have a cost as well. And so in the end, I think this kind of communication with your doctor will be efficient, cost effective, and have high value if appropriately tailored. So not the complex problems, not the in-person problems. And let's save those visits when it's needed, for when it's needed.
Thank you so very much. And also, I just want to mention that the website with the billing information is mentioned in the Q&A, so you can have access to that as well. Dr. Wong, how will patients know if they were billed for a message?
Yeah, thanks, Anita. Sorry, I think I kind of like smushed this into my last answer too, but let me just make this specific. So one, you will have to consent before sending a message. That's kind of in the box to get to typing the message. Two, you should be able to kind of clue in by the type of response you're getting from your provider. You know, one, if you just get an answer, you know, from a staff member, that's not billable. Like if my nurse, you know, is able to give you some information about, you know, yes, take this Tylenol, or, you know, you can interchange with ibuprofen, you know, et cetera. That's not billable because it's from a nurse, not from the doctor. And then if you do get into a correspondence with your practitioner, you know, they're asking clarifying questions, you know, they're reviewing your chart, you know, they're giving you options, you know, things that feel very similar to what you would do in a visit, that probably means they're billing that visit. And then lastly, if when it is billed out, if this message was billed out, you do get an auto-generated message in MyChart saying that this message was billed.
And then, Dr. Wong, there's a question in the Q&A. Will these same rules apply to phone calls? In other words, if you call and talk to your caregiver and it takes time to research the question, will you now be billed for this? Billing has not occurred like that in the past.
Yeah, thanks. So telephone calls are not billable. Now, let me just make a distinction because we have been doing phone visits. This is like a scheduled appointment with your doctor. This is something that we made available during the pandemic for our patients that couldn't do telemedicine with video. And we're still doing phone visits because those are still being reimbursed right now through CMS. There may be some changes with that in the future, but those are billable, but that's like a scheduled appointment. You know, you have an appointment with Dr. Wong at 1:30 on Friday to do follow-up of your CHF, and it's on the phone instead of on video. Telephone encounters where you pick up the phone to just call, leave a question, those are not billable. The CMS codes for digital evaluation management do not apply there.
Another follow-up question is, other local health organizations are asking their patients at annual visits to acknowledge, sign receipt of this messaging, the portal billing option. Will UW also be doing this?
Oh, that's interesting. I think that's above my pay grade. That's probably something for our compliance officers to ask.
Thank you.
I'm not a lawyer.
All right. So the next question, Dr. Morales, is where can patients get more information about MyChart billing and their personal financial costs, including how to get help with medical bills? And I know that some of this has already been answered.
Yeah. Well, first of all, again, I think I just want to say we don't want these costs to be to keep you from trying to use the service and increasing your communication with our healthcare team. So we want you to increase communication. So please do try it and see if you find value in it. If anyone has a financial need, we have a financial assistance program. And I did notice when Dr. Wong was showing you the screenshots, there's actually a tile there that says questions about financial assistance. So one way to get to that assistance is directly through MyChart. And you could do that before choosing to pose a question, for example. There's also a website where you can get your questions answered and a phone number. And I hope our team here is putting those out in the Q&A stream so that you have them at your fingertips.
Thank you. Dr. Wong, is this billing for MyChart messages only for MDs, or is it for other healthcare professionals as well, such as PAs and ARNPs?
Yeah, so it's anyone who can independently bill what's called professional billing. I don't want to get into some, billing lingo, but basically any independent providers that can see a patient can bill these codes.
Thank you. And is there some, one of the questions that I have in the Q&A is, are there a certain type of questions that will be billed and others will not? I know you answered some of it based on the time that the provider spent, but is there anything specific based on the patient questions based on their severity of their symptoms? Is that a consideration with billing?
Yeah, so, I think, again, I think it's everyone's just trying to get a feel for, what's billable and what's not billable. So, I think one of the beauties and the freedoms of MyChart messaging, and this is why patients like to use it so much, is like literally anything can go in there. I've had pictures of rashes sent to me. I've had articles sent to me. My mom had something happened to her sent to me. It's really like a free for all for patients to, feel, like they have good access to their care team and typically their continuity provider who they trust. So, the way that the billing rules are written is kind of almost more like negative. So for instance, if it's anything, it doesn't matter under the sun that takes less than 5 minutes, it's not billable. If it's something that's related to a visit that was already charged, like you just saw me yesterday and you had a question about, something we talked about and you might chart me, that's not billable because you just saw me and I already billed out that charge for that medical evaluation. A lot of the other things, really fall into this like very quick established service where it doesn't take me medical expertise. I don't really need to think that hard about renewing your massage referral. I don't really need to think about referring, renewing your birth control because you've been on it for a long time, you're doing great on it, et cetera. It's really things that, we have to put a significant amount of time and thought into. And sometimes there are medical questions. Sometimes, patients, they send me a really large article they read and they have questions about if it applies to them or something. And I don't have a lot of time to read long articles, but if that's really important to the patient, I do have like a ability now. I don't know if any of the other panelists want to respond to that.
I think also what I say to my patients sometimes is they send me a question that seems really straightforward. For me, it's about hormones, right? It's not usually a yes or no. It's nuanced. So, and it's so nuanced that going back and forth almost doesn't even make sense. Then sometimes, yes, I will say, come back, but sometimes it does make sense. The patient lives a ways away. I don't have an actual scheduled slot for a while. Then we have that conversation, and it can be paragraphs back and forth, back and forth, back and forth of nuanced discussions about hormones that are unique to them. So I think, that falls in that group of, it makes sense that that's a billable e-care message or encounter.
One of the questions that we have, Dr. Morales, is the patient portal available for non-billable research visits? And how does that work?
I don't know the answer to that. I don't know if others do on the panel.
Yeah, I can try my best stab at that. So I suppose if you're communicating to your care team via MyChart in a non-billable research visit, I guess that pathway is available, but those are not billable. It's like a not billable service. So if it's not billable, all of these things are not billable, however you use the chart. So let me just see if there's other questions in the chat. It seems like we've gotten through the prepared questions, right, Anita? Maybe.
No, I'm moving on to.
You want to help us?
I have moved on to the other questions, and one of the questions that I have is sometimes patients are sending messages, the same message to multiple providers on their care team. How does that function, and will they be billed individually by each of them?
Yeah, let me talk about that. We've actually had to send out a FAQ to providers too, because, you know, again, this is new for us. And we do know that patients have multiple physicians or APPs on their care team. So the way that CMS quantifies billing, like duplicative billing, is if it's within the same specialty. So for some reason you sent a message to like 2 family doctors, only one of us could bill. If you sent a question to your PCP and your specialist, both of us could bill because we're in different specialties. I think the way that I would think about this is it's just like you come see your PCP, you have a new problem. I start the evaluation and then I say, you need to see a specialist, and then you go see a specialist for that condition. You know, both of us are coming at the problem in a different way. You know, I think a lot of times patients come to their primary care doctor for this, like, how does this plan fit into, you know, the global constellation of me, whereas they go to the specialist for, like, I want like the most detailed evaluation in all of the potential options for me. So it's a different lens that you're getting a question answered, and I can understand why patients, you know, would want to do that to just get a different perspective.
Also, Dr. Wong, what about referrals? If a provider is generating a new referral on patient request, does that also count as a billable?
Yeah, so I think it's the answer is it depends, because there are simple referrals like, oh no, I sprained my foot, I think I need some PT, and no problem, go see some PT. I'll write that referral for you really quick. And then sometimes I get complex ones like, Dr. Wong, I think I need to see a rheumatologist because now my hands are swollen and my mom has RA, and what if I have RA? And that's like, whoa, one, you don't want to show up at the rheumatologist just like that. You want to get prepped. We probably should order some labs. Maybe we should get some x-rays. Maybe we need to talk a little bit about this first. And usually when I see those types of complex referrals, I'll ask them to come in for an appointment. So, that type of facilitation, as long as it's medically safe, if you tell me you want to see cardiology because you're having chest pain, I'm probably going to say, you need to go to the ER today. But, for those types of things that are safe to do via MyChart and would save a patient an appointment, those would be billable. But a lot of referrals are real simple, and those would not, if it doesn't take, that evaluation and management from your physician.
That's really helpful, that you clarified that. How about, Dr. Wong, how about FMLA paperwork, which patients will often require, and sometimes it needs to be renewed for another year. At other times, they realize after the visit that they need FMLA paperwork filled. Is that billable for patients?
Yeah, and again, I think it depends on the paperwork. Do a lot of FMLA paperwork, and it can get a little hairy, especially if things are not just cut and dry. You need extensions of your FMLA because your condition's not getting better, or you're still getting active treatment, et cetera. I think it depends on how much back and forth. If we just had an appointment and we talked through it, and I know it's coming, I know what to put in it, then no, I'm not going to build that out because, I already pre-talked it with you. But, sometimes it's out of the blue. I haven't seen a patient in a while, and, they want, some sort of accommodation for something. And, I'll usually, again, call them in for an appointment because I just need to hear the whole story. So I think if the patient preferred to do that via MyChart, that would be billable because it would be clarifying the qualifying condition and the terms of the leave and what accommodations and what things do I need to tell your employer you can or can't do. So that does take quite a bit of time.
Thank you so very much. And this brings us to the end of the questions that we have. Unless any of you have any further comments, but this has been an amazing session.
Well, I have a question. And it is MyChart messaging English only? In other words, is there some guidance around that, or is there a compliance issue, a safety issue? I don't know if you can speak to that, Dr. Wong.
Yeah. So I think what I would say is, if a practitioner is fluent in the language and they're, you're corresponding, that's really under your professional licensure, and you have to just determine whether or not you have fluency to be able to practice medicine in that language. So that's kind of like out of scope. Now, if you're someone who isn't fluent in the language and a patient is sending you messages in their home language, that really should be sent to interpreter services to interpret. And for you to give a response, either you'd have to give it in English or get it translated. And our interpreter services is willing to do that. I would just say it is kind of like a lot of hoops to jump through right now. And personally, when that happens for me, because I do have a lot of patients who prefer a language other than English that use MyChart, typically I'll just jump on the phone with them and we'll do an interpreted visit, or do a telemedicine visit with the family present, because it's true, MyChart is very, very nice to use, like for all the other tools in there.
So I guess maybe then the advice might be, if you have an agreement with your provider in advance to communicate in another language, that would be okay, but probably best in English until you know that you can have that communication. I'm just wondering, it might be, you might be a lot of responses in another language, and then you're having to rely on interpreter services, and that adds time. And I'm just curious.
Yeah, I mean, I know that there are active initiatives at UW to try to make MyChart accessible in other languages, but it's quite complicated, and unfortunately where we are right now is, if you do want to do that, there is complexity to how you handle that situation. There's no easy button for that right now.
Okay, thanks.
Thank you all so much for joining us today. Please take a moment to open any links that are available in the chat before we close this screen out. There's a link to the Community Conversations website where you can go to see the recording of this that will be uploaded in the next couple of days. In addition, there is that sort of Q&A for MyChart messaging and billing. That link is in here as well. It's a great resource. It also has information for financial assistance if you are interested in that. So a great link to have open and to share with any others that may have questions. Thanks again for joining us, and we will see you next time.
Thank you very much.